Today, the topic of our discussion is going to be to essentially explore how transitioning to clean and healthy energy can both safeguard public health and strengthen energy security in the global south. And this is based on the fact that we already have ample evidence to show that the dependence on fossil fuels continues to harm public health and undermine energy security. And this is particularly the case in the global south, where air pollution, climate-related health risks, and inequities in energy access have a disproportionate effect on climate vulnerable populations. So we're trying to discuss today how we can ensure a just transition for such communities and ensure that it's done in a way that they're not left behind. We're very grateful to have with us three very knowledgeable and insightful experts in this space to provide different perspectives on the just transition in the global south and what that can look like from both practical policy and other perspectives. And so with that being said, I'm just gonna jump right into our first speaker as I want to give the floor to those here that have the expertise to speak on this. So our first speaker is going to be Dr. Marino Ramanello. Dr. Ramino Ramanello serves as the executive director of the Lancet Countdown, which is an international research collaboration that monitors the health impacts of climate change. And in addition to her leadership role, she's also a climate change and health researcher at University College London. Her work focuses on tracking the evolving links between health and climate change with the aim of informing a robust response that protects and promotes human health. So we're lucky to have Marina here to share with us her perspectives, and you may go ahead with your presentation.
Thank you so much, and thank you for inviting me and for giving a bit of spotlight to this very important issue. So as you've just heard, I'm the executive director for the Lancet Countdown on Health and Climate Change, which is in essence a very big research collaboration that brings together about 300 researchers from around the world. And what we do is draw on experts from various disciplines to paint a global picture of the state of climate change and health and update that picture on an annual basis. So every year ahead of the COP climate negotiations of the UNFCCC, we come together and we publish these reports in the Lancet that have over 50 indicators monitoring both the health impacts of climate change, but importantly, the state of progress towards adaptation for health, mitigation and health co-benefits, the economic transition to a healthy future, and how are different key actors in society engaging with climate change and health, knowing that that engagement is so crucially important for the actions needed to happen. The latest report that we published back in November or October last year, 30th of October, the key finding and the most striking finding actually is that across 2/3 of the 15 indicators in which we monitor the health impacts and hazards of climate change, we're seeing a concerning new record high being reached in the latest year of data. You can see in that heat map that I'm showing on screen, each row represents an indicator, and we've color-coded those indicators such that the best conditions for health in the time series is in blue, and the worst conditions of health in the time series turn to red. And you can see that very clearly shift towards red colors in nearest years, with the asterisks that you see in some of those boxes, noting when the latest year of data has reached a new record. So this is what we're seeing, a rapidly worsening situation across most, if not all, of the indicators in which we're monitoring the health impacts of climate change. And what this means is that the threats that we're facing from climate change to our health, to our well-being, and to our survival are growing year on year, and that people all around the world are facing not just the threats of extreme heat, or the threats of extreme weather events, or the threats of increased climate suitability for the transmission of deadly infectious diseases, or not just pressures on their food security and economic well-being, but they're facing all of these at once, with the health impacts of climate change adding on to one another and compounding each other to generate a bit of a perfect storm. And it's important to know that it's our health systems, by and large, that will be on the receiving end of those impacts. Our health systems that are already stretched, generally underfunded, and generally quite ill-prepared to cope with climate change, with education for climate change and health still lagging in most parts of the world. So there's a lot that we need to do in terms of strengthening our health systems, adapting our response to climate change so that we can actually protect people from the growing health hazards that you can see on screen. Now, this has happened, as you see on screen, up until 2023. This is what we see up until more or less present day. And up to more or less 1.3 degrees Celsius of global mean temperature rise. The problem is that we're currently headed to 2.7 degrees. The latest record heat years tells us that we're probably scratching the early years of a world above 1.5 degrees of heating. So mitigation becomes really urgent, particularly to protect the most vulnerable populations from climate hazards to which it would be very difficult to adapt, if not impossible, in a world that exists at 1.5 degrees. But I'm going to move us on with that note to what's happening in terms of mitigation, the efforts needed to prevent the worst outlook of mean temperature increase, and to ensure that we keep global temperatures to levels to which we can still adapt. And as you will know, the biggest single contributor to greenhouse gas emissions that are warming our planet is the energy system. The energy system, as you can see on screen, is still 81% dependent, our global energy system, on fossil fuels, coal, oil, natural gas. And the greenhouse gas emissions from our energy system, far from falling, keep on increasing year on year, pumping extra, each year more, greenhouse gases into the atmosphere, greenhouse gases that will remain there for centuries. These emissions have reached a record high in 2023, and everything goes to tell us that probably 2024 was also a record year. So we're not really doing nearly enough to mitigate climate change and avoid the worst outlook. However, it is true that we're starting to use renewables much more than we'd expected, and that the growth of the percentage of electricity produced from clean new renewables like wind, solar, geothermal is growing really rapidly, as you can see on the graph on the right. We've reached record highs year on year in terms of renewable energy production. It's now accounting for about 10.5% of the global electricity supply. However, as you can also probably tell from that graph, there's very, very big inequalities in how renewable energies are being used in different parts of the world. So when we look at countries according to their Human Development Index, that is a metric of health, education, and economic well-being, we see that the most vulnerable countries, generally the poorest countries, the most underserved, that are the low HDI countries, are lagging enormously in the adoption of electricity produced from clean renewables. The lead is by far being taken by very high Human Development Index countries, highly industrialized countries with high levels of local technology access. And the reason this matters for health is that it's directly related to our energy use, and energy is a key determinant of health outcomes and well-being. We see that 2.4 billion people around the world still rely primarily on dirty fuels and inefficient technologies to meet their energy needs in their homes. These are the burning of biomass like wood, dung, or the use of solid fuels like coal that are highly polluting. As you can see there, when we look at different parts of the world, for example, in Africa, you see that 86.3% of households rely primarily on the use of biomass and waste. These are very inefficient technologies. They don't allow for electrification and the use of proper energy for heating, for cooking, or for accessing information services. It also means that generally it is women and girls that are in charge of sourcing the biomass for cooking and heating in the household sector, and that keeps them away from employment and education. So huge gender equity problems that come associated with energy poverty. The lack of access to clean energy and to electricity and reliable energy sources also means that there's little access to electricity needed for refrigeration of food and medicines, to keep household temperatures in safe conditions, or to access potentially life-saving information services. So this picture of energy poverty is a health problem. And the important thing to note here is that with the deployment of clean new renewables and microgrids, there is a possibility of providing reliable electricity access to remote locations. And that's a lot cheaper today than access to fossil fuel-based energy. So there's no reason why this needs to persist. But the fact that the lower HDI countries are lagging in the adoption of renewable energies probably means that we're not really solving this fundamental issue of energy access and equity. when we look at what this means in terms of household air pollution, obviously burning dung, biomass, coal leads to really high levels of household air pollution. Those spending most time at home, generally, again, women and children will be most exposed. From the 65 countries for which we have data and that are mostly dependent on dirty fuels in the household sector, we estimate that there have been 2.3 million total deaths in 2020 for the use of these dirty fuels, with a big divide, as you can see on screen, between rural and urban households, rural households disproportionately affected. Obviously, that's household air pollution, all of this burning of dirty fuels, not only in the household sector, but also, as you see in screen, in our power generation, in power plants, industry, transport, and even the waste burning and agricultural activities also contributes to really high levels of outdoor air pollution. And we estimate a total of 8.4 million deaths attributable to PM 2.5, similar numbers to those that have been produced by the WHO and others, of which we find that about 2.1 million are directly attributable to the burning of fossil fuels. And as you can see there, fossil fuels disproportionately contributing to the exposure to air pollution coming from power plants, transport, and industry household sector. Coal alone contributed to almost 1 million deaths. Coal that we know is highly inefficient, is highly carbon intensive, contributes a lot to greenhouse gas emissions, and also very intensive in terms of its air pollution potential. So these deaths, all of these millions of deaths that we're seeing, with anthropogenic contribution, about 6.4 million of them, could be by and large prevented by transitioning to clean energy systems. Now, the transition to clean energy, as I said, renewables are in most places a lot cheaper than fossil fuels. They're not bound to the geopolitical pressures and instabilities on global fossil fuel markets, which generally are centralized in big corporations or in big countries. So they can be a lot more localized and much more resilient to geopolitical fluctuations in price. But we see that there's still a big pressure to our countries and our even our social systems coming from the persistent dependence on fossil fuels. Because of the fact that most countries still disproportionately depend on fossil fuels to meet local energy needs, what that results in is that when we see spikes in fossil fuel prices, like the spike that we've seen as a result of Russia's invasion of Ukraine, or any other type of market crisis like we're seeing now, that results in energy prices globally going up disproportionately. And in countries that are disproportionately dependent on fossil fuels for their energy needs, what that means is that governments resort to subsidies to ensure that energy remains affordable and to prevent a spike in energy poverty, which is a health risk. So this dependence on fossil fuels, in a nutshell, in 2022, resulted in countries allocating $1.4 trillion to net fossil fuel subsidies, taking into account all taxes and all carbon pricing instruments. $1.4 trillion generally from taxpayers' monies that are going to keep energy prices lower, that keep on incentivizing the consumption of fossil fuels and end up in the pockets of fossil fuel giants that are making record profits because of the high energy prices. One thing that is worth noting, subsidies exceeded 10% of the national spending in more than half of the countries. And in about 1/3 of all countries, it exceeded 100% of the total spend for healthcare. So countries spend more on fossil fuel subsidies than on healthcare. Obviously, this contributes to inequities. This contributes to the fact that we have less funding available for health systems, for social services, for health and security. One thing that I did want to note, and I will just close with this slide, is that we have a lot of information on the harms of climate change on health and on the harms of fossil fuels and its associated environmental hazards on health. But the vast majority of this knowledge comes from high-income countries. Still, the science is dominated by researchers in very high-income countries. And that means that the local hazards that happen from the fossil fuel industry, generally at extraction sites that are in the most underserved parts of the world, or even in indigenous communities within high-income countries, don't very easily get captured in the scientific literature. So there's a huge range of harms that we're not probably assessing very effectively through the scientific literature that is peer-reviewed and published, generally in English. So just wanted to know that there's a lot more that we need to be doing in terms of providing justice to contributions to the scientific field as well. And with that, I will just note the Lancet Countdown has regional centers, and we're soon going to announce the Africa Regional Center launch. So we're hoping to start helping to bridge that gap as well. And with that, I thank you very much for your attention, and I hand back over.
Amazing. Thank you so much, Marina, for that very, very valuable discussion and presentation. It's really, really impressive how much the Lancet Countdown has done to really show these direct and cascading impacts of fossil fuel dependence, and you know, the various downstream implications of that. So I think that this is really important work that you've presented to us, and it's much appreciated. Moving now into the next speaker for another perspective on this topic, we have Annabella Rosenberg, who is the Senior Advisor on Just Transition at Climate Action Network International. She focuses on integrating social justice into climate policies. She has a background in trade union and environmental advocacy, and she's worked globally to promote climate action that prioritizes vulnerable communities, especially in the global south. Her expertise includes alliance building between unions and environmental organizations to ensure that social justice is central to climate solutions. So with that said, I'll give the floor to you, Annabella. Thank you so much.
Thank you so much, Anna, and thank you for the whole CELF community for welcoming us in here as Climate Action Network. And thank you also, Marina, for the intro. I mean, I was thinking about my presentation as you were speaking, like framing all the good reasons the world has to phase out fossil fuels. We have a bunch of reasons, but for some reason, this is not happening. And yes, a part of it is because there are a lot of vested interests trying to sustain the system as we know it. But I want to share with you today in this webinar a little bit of the other part of the story, of what are the elements of this climate story and of the fossil fuel phase out story that has not really captured the needs of working people, of those in most vulnerable situations when thinking about the clean energy transition, trying to offer also a few thoughts about the kinds of approaches that could take also people with us in trying to change the system as we know it, and that fossil fuel dependent system that we know it. So first, when we are thinking about the transition, it's not only about a source issue. This is not only about replacing fossil and getting into renewables. There are a number of elements that need to be factored in, again, if we want to center people and communities and workers in the way in which we are approaching it. So when we are thinking about that energy transition, I think one of the important things that we need to capture is that that transition is not happening in a vacuum. It's not that we were all happy living together with some health issues and some environmental consequences of fossil fuels, but the rest of the society was fine. Reality is that inequalities have never been worse, at least for the past 100 years, that we have record unemployment numbers and precarious work mounting, the levels of people working in informal situations, it's huge. I mean, a majority of the world is working with no protection, no labor contract, nothing. And for the ones that have a job and have some form of contract, the level of precariousness is also increasing. We have also, and this is something that I guess no matter in which reality we are operating, it's the case for sure in the Global South, but not exclusively in the Global South. Many of those social ills, whether we are talking about unemployment, whether we're talking about inequalities, are being used to further undermine public services. So what we are seeing, or also attacking further vulnerable populations. So the whole discourse against migrants, for example, or what we can see in countries like mine, in Argentina, massive cuts in public services, including the health systems that Marina was referring to in her presentation. All of that is being bundled into approaches to to the state and to society that are going in the opposite direction. And that means that this energy transformation that we're talking about has a context. And the second element that I wanted to acknowledge is that when we're talking about just transition, we are not talking about a concept with no background. It's not just that we are going to come and say, okay, just transition is all of this. I think we are trying to build on a history that is coming indeed from the trade union movement, but from a very specific grassroots community level engagement. And this was coming, I mean, as you might know, in the 70s, when some trade unions that were impacted potentially by the new health regulations coming from what was then the creation of the EPA in the US and different the Clean Water, Cleaner Acts, were being used by employers, by corporations, to get trade union support to block those environmental regulations. And at that time, this union, the Chemical Workers Union, came with the idea of just transition to say, well, our allies are the communities and not our employers. And we need to figure out a way in which we can transition away from pollution in a way that respects workers, respects communities, and allow us to have an alternative livelihood. So it's very important that when we are thinking about how we make this happen, we really place working people at the center of this transformation, because we are the majority, and this is the support that we need to carry the transformation that we need in our energy systems. So the second element, and I will not read this whole slide, that I would share with you, but I think it's important for us to place the transition in the energy system a little bit in a broader trajectory. As I was saying, the world is not working very well for the majority of people. So we need to figure out a way in which the vision of the journey we're trying to walk together goes beyond the simple shift in energy sources. We really need to offer a vision of a world where everyone has dignity within planetary boundaries. And here there are different elaborations of the Climate Action Network of how we say that. But bottom line is that it's not just an offer about these two little things, and when you just put your electricity, this is what it looks like. It's really about the kind of transformation that we need. Also because our economies have been built on fossil fuels, the way in which they function, the services that they provide, the consumption pushes they create are all based on its dependency of fossil fuels. So a renewable energy based economy doesn't necessarily go in the similar direction, or should not go in a similar direction that the one that we built up to now. So we need to offer a just transition to somewhere that is somehow more appealing than the world that we are living right now. So when we're thinking about a just transition to clean energy, as the title of the webinar was inviting us to reflect, I think we are trying to think then about three different aspects. On top of the fact that we need to transition away from fossil fuels, this is like the basis of Can's work. One is that we need to take care of all those impacted by the phase out. And here, of course, we can think about workers in the fossil fuel industry, but also about the communities that are handling the legacy, for example, of the fossil fuel industry, when we know that a lot of them have shut down and abandoned territories where they have exploited, whether it's coal, oil, or gas, and left people and communities behind with a terrible legacy of health and pollution consequences. It's also about taking care of those territories, those communities, those cities that when those companies leave have very limited resources to keep paying for public services there. So we have created a past dependency in many of those territories. So when we shut down, this goes far beyond the issue of employment. This goes into who pays for health, education, roads, etc. And then we also have the issue of the affordability of energy for many people, adding, of course, the fact that a lot of them today are sourcing energy in completely unsustainable ways and very expensive in terms of time and resources to get energy. So there is a chunk that is related to those impacted by the fossil fuel industry that we need to take care of. A second layer of this is trying to figure out what just transition looks like for phasing in renewable energies. because renewable energies, I mean, indeed represent a lot of opportunities, whether it's for job creation, for cleaner air, but we also need to understand that there are different ways of promoting a renewable energy powered society. And what we have seen, for example, if we go to the issues related to employment, is that employment in the renewable energy sector tends to be more precarious, for example, than in other energy sectors, that we have seen, for example, that the uptake when it comes to women is less than what it should. The rate of training for women in the sector is relatively low. Also, that it's quite short term, and there are not that many people that remained employed in the renewable energy sector. But on top of that, and I think much more difficult, I guess, for us as a conversation, is how do we handle the extraction and processing of the minerals needed for a battery-based economy, which is what is underpinning, of course, 100% renewable energy society. What does it mean in terms of sacrifice zones? That, I mean, how do we manage the demand for those minerals? And of course, trying to ensure that our push for 100% renewables comes also with a push for reducing, for example, energy demand, in particular in the global north. And they need also to take into account which models of energy access. Like, are we talking about basically a corporate-led renewable energy deployment, or can we think also about ways in which communities can benefit from that deployment with distributed energy, but also with cooperative models and other ways in which the benefits of renewable energy generation could be shared differently in society? And the third chunk of just transition work is about thinking what are the alternatives for countries that today have a too limited policy and fiscal space to move away from fossil fuels. Because fossil fuel dependency is not only an energy access conversation. It's also a debt conversation in many countries. It's also a how do I fund my public services conversation. So we also need to figure out from where are those countries going to get their foreign currency from when we are phasing out fossil fuels. So all of these are the complicated discussions that we need to face, I guess, as a climate movement, as all of those that believe that the phase out is necessary, because that holds the key for public support and public mobilization, and for basically taking away the social license that until now the fossil fuel industry has had with them. I will not walk you through this, but there are, of course, a certain number of principles that we are building on when we are thinking about a just transition. And all of those you would see, I mean, are, I think, very close to the approach in which the health community is thinking about how we secure dignity for people. But I wanted to just leave three elements that are critical for us moving forward on this clean transition. One is that we need institutions to handle the transition. This will not happen on its own. It will not happen just by market forces or by the fact that renewable energies could be cheaper, potentially. Right now, I mean, unfortunately, fossil fuels are also going down, and we cannot just base ourselves on the market pricings for handling this transition. We need institutions, we need goals, and we also need that those institutions capture the voices, get the voices of the communities and those impacted in a way that can balance the power of other interested voices in the conversation. The second element of a just transition needs to be about restoring what has been harmed and protecting the ones that are impacted. What are universal social protection systems' role in this transition? How do we ensure that rights are at the heart of this transformation? And the third one, as I said, this is about visualizing the future. I mean, it's one where people have more dignity, whether we live within planetary boundaries, but we also have something more positive to say about our quality of life, about our well-being at the end of the road.
Thank you so much for that really, really rich and informative discussion. Super powerful, all of your arguments, and I hope others are as inspired because yeah, very, very well said. So just now, given the time, I'll jump right into our last speaker, who we're also very, very lucky to have with us today. Our last speaker will be Bonang Mpinen, who is the Director of Operations for Partners in Health Lesotho. Throughout his role, he's led several impactful projects, including the Rural Electrification Initiative, co-implemented by Partners in Health and One Power. And this project has effectively transitioned hard-to-reach health facilities from reliance on diesel generators to solar energy, which offer obviously a more clean and sustainable power source. This initiative has significantly improved healthcare service delivery for marginalized populations in the mountainous regions of Lesotho, enhancing reliability and accessibility of care. And so it's this initiative that Bonang is going to speak more about today. And we're very grateful to have you with us. Thank you, Bonang. I'll give you the floor now.
Okay, thank you so much, Hannah. And I think a big thank to our core panelists. This is very exciting, Marina and Annabella, for your insightful presentations. I hope I'm audible enough that side. It's an honor to be here today and to have the opportunity to share with you the work that PH Lesotho actually is doing in the healthcare solarization space. Like Hannah has rightly said, I'm actually here in Lesotho working for Partners in Health as a director of operations. Actually, I have been an active member of green teams within PIH, one PIH globally, and I have participated indeed to several sustainability focused initiatives, like she has rightly said. And today I'm happy to come in as well to share the experiences that we are having here in Lesotho. Well, I think, like I've rightly said, as PH Lesotho, we had to as well participate in terms of transitioning our health facilities from a dirty source of power to solar power. So that's what I'm going to share with you today. Let me just take you into context. Lesotho, known as the Mounted Kingdom in the sky, is actually the only country the entire world which is 1,000 meters in elevation. While its mountainous terrain is breathtaking, but it poses a significant, infrastructure development challenges, as well as the movement of the persons. It's indeed a serious challenge. So many of our people are staying far from, the basic utilities like running water, electricity. So alarmingly, nearly 60% of the facilities do not have a reliable electricity in Lesotho. So Lesotho actually, it's most of the health facilities, which is very normal, are run by the government. So then we have Lesotho Red Cross and as well as Christian Association of Churches in Lesotho running the rest of the other facilities and as well as the private facilities. So, but fortunately, we have two specialized facilities, one run by PIH Lesotho, which is for MDR TB, and then we've got mental health run by government, and we've got one referral hospital. So we'll then move to the next slide. It's important that I share that it was actually around March 2021 when Power Africa and Sustainable Energy for All initiated a health facility electrification grant as part of COVID response efforts. The goal was to install electricity in health facilities so that they could operate around the clock. As it has been, observed that most of the facilities do not have electricity, as well as if they do, it's unreliable. So it was under the same opportunity that Partners in Health partnered with One Power Lesotho to implement the rural initiative, a health facility electrification project at 7 hard-to-reach health facilities supported by PH Lesotho, namely Ngao Health Facility, Lebaking Health Facility, as well as Manmani, Metalaneng, Nohan, and Tanyako. These are the health facilities that are supported. They are owned by the government, but they are supported by PH, and their location is in a very hard-to-reach setting. It's difficult for the patients to reach the facilities, and now talk less of when they're at the facilities. Now there is darkness, so that's why PH stood up, partnered with One Power to make sure that we electrify these health facilities. So this is what is happening. PH Lesotho, on the same health facilities, we operate what we call maternal waiting homes at all our clinics. And then this is where pregnant women often travel on foot for days, sometimes on horseback, in their 38th week to stay near medical care before their due dates. But even with this compassionate health staff that we have there and equipment, these women still face the risk of delivering in complete darkness due to power outages, the challenge that we're having because we have been operating all our health facilities using or powering them through diesel generators 100% of the time. So it was very challenging. We faced a lot of problems that I'm about to take you through right now. Let me just list some few challenges or give you an experience before solarization. Before the solar installations, the 7 RI sites, the one that I've just mentioned, they relied heavily on diesel generators. It was an unreliable, unclean source of electricity, which we are just trying to transit from. Even the vehicles transporting the same diesel ran on diesel. So it was very costly as well. This dependence led to frequent power outages, disrupting our clinical, operations most of the time. Challenges that were actually faced by our team on the ground as well as the patients. Us as PIH, we bear the high cost of procuring this diesel, and the disruptions or power outages were led by the delayed delivery of diesel due to maintenance terrain. All these health facilities, like I've mentioned, they're located far right into the mountain part of Lesotho. So it's very difficult to get to these health facilities. But we tried our best as PH Lesotho to make sure that we deliver this diesel to make sure that our clinics are powered, at least most of the time, though despite the challenges that we have already mentioned. And even the baby deliveries, in most cases, were done in dark, which led to a lot of other health challenges. And again, we have to, our nurses have to use risky and unreliable gas lamps during deliveries in the dark. While it's dark, it was indeed another challenge because they sometimes have to go in the night. We are talking about female nurses. They go in to start the generators. It's very risky for them as well, and there is noise. There is all those challenges surrounding all that. So, and we were unable to use a lot of medical equipment such as ultrasound, baby warmers, autoclaves, and many other diagnostic machines, and as well as the refrigerating the vaccines or medicines that require lower temperatures. It was actually a challenge because we're now not ready to continue, running generators to operate some of this equipment due to the damage that was likely to happen to them. So imagine going into labor in the middle of the night without power. Nurses used gas lamps, like I've already mentioned, and it was very unreliable due to inconsistent electricity. Like I said, a lot of our equipment were just lying there unused, and it was indeed a challenge. As you can actually see on my bottom right, there is nursing in charge, Mematato, using that particular gas lamp inside a maternal waiting home during a delivery. It was indeed challenging. Let me move to the next slide. So, as we continue, we actually faced a number of challenges that we were actually trying to make sure that, let me move to the next slide. Yes, we now decided as an organization through the partnership that I've talked about that we really need to transit from this dirty form of energy and now move to solar energy. That's why we forged a partnership with One Power under that opportunity grant I've talked about. PH Lesotho equipped all rural health initiative sites, the one that I mentioned, with solar infrastructure, significantly enhancing care delivery. This is where we decided that, okay, fine, since we have been experiencing some of these challenges, we really need to move we need to transition. Previously, power outages occurred about 5 times a week, often lasting hours. Since transitioning to solar, such outages have become virtually non-existent right now as we speak. This shift brought immediate and substantial improvements. Because of this transition to solar, we had to upgrade we had to upgrade the electrical infrastructure along in all our health facilities. This is rewiring because of some other challenges that we're experiencing. And so now we are enjoying some of the improvements as far as the solar transition is concerned. We now have sustainable and reliable clean source of electricity, avoiding most of the operational disruptions we used to experience in the past. Not only that, financially and operationally, there is a very good impact and progress made. Solar energy also yielded significant cost savings. Previously, we actually estimated around $700 per month that we are spending on diesel, but we managed to cut that into half, moving to solar power solution. So maintenance costs for solar systems are also far lower than for diesel generator, as this is outsourced and done by our partner One Power. We used to spend a lot on diesel and generator maintenance. Now, the money saved can be allocated to other, medical equipment and enhancing essential healthcare services. Safety and operational efficiency have improved too. We now have proper wiring, like I've already mentioned, which is much more severe, and we don't have electrical cuts or outages as we used to. And reliable electricity has enabled greater use of diagnostic and treatment equipment, directly impacting our patient care. Looking into the future now, having transitioned to solar power solution, beyond immediate benefits that I've just shared, this has elevated the quality of healthcare by enabling consistent use of medical tools, freeing up funds for critical services. The success of the solar project could serve as a model for other low and middle income countries facing similar challenges. So Lesotho now, we are happy to share our experiences across, like we're doing, because this initiative shows how renewable energy can drive healthcare transformation, improve reliable safety and cost efficiency. We can actually see on our bottom right that we are now even be able to use these baby warmers, which were just lying there unused, but now we are in position to use equipment such as this one, which indeed improve our patient care. Let's quickly move to our next slide. As we conclude, the solar electrification project at PH Lesotho RI Clinics stands as a powerful example of climate resilience and action in healthcare by replacing unreliable diesel system with sustainable solar power. So we have actually achieved the following: improved healthcare quality, enhanced patient safety, reduced operational costs, strengthened resilience in remote, undeserved areas, improved communication. Our staff now are able to use computers, charge their phones, having internet, almost 100% of the time. So according to the founder and the president of PH Lesotho, if access to health care is considered a human right, who is considered human enough to have a right? I just want to leave you with that. Thank you so much.
Thank you so much, Bonang. Really, really insightful presentation, and really, really impressive what you guys have accomplished there. And it's really, it's just really enlightening to hear kind of a practical and on the ground perspective of how this can kind of work in practice, and the far-reaching ripple effects of transition to these renewable energy sources. So again, a really, really great contribution and complement to the other perspectives shared. So thank you all so much for your wonderful presentations. Very, very insightful. We have about 10 minutes left now to move into a short Q&A session. We have only a limited number of questions in the chat, so I might just give a few more minutes for people to write questions if anyone has them. In the meantime, I'm going to kind of move into some questions specifically directed to the speakers based on the different topics you've covered. So starting off with Dr. Marina Romanello. So recognizing that fossil fuel industries have deeply entrenched influence in many low and middle income countries, not only economically, but also politically and socially, what strategies do you see as most effective in countering this power and advocating for a just transition that prioritizes health? In other words, how can health professionals and advocates in these contexts build coalitions to challenge industry narratives and push for cleaner, healthier alternatives despite constraints such as limited policy space or industry capture?
Thank you so much. Look, that's a very interesting, I think, important question, because we have done this before with other industries. We have managed to set environmental regulations for health in other contexts, and from the experience of health professionals, there's a lot that we could offer in terms of exposing the harms that the fossil fuel industry is doing to people and their health. We've done it with other environmental contaminants. We've had it also done with tobacco and a few other sectors. The one challenge that we face when it comes to climate change and health and fossil fuels and health is that on the one side, for climate change itself, attribution becomes a problem and is weaponized. That the lack of attributable contributions to climate change, or the difficulty of attributable contributions, has been used before to disregard claims being done on the harms of climate change on people. So that is a technical artifact, because we know that link is there, we know what the contributions are, but it's a technical artifact that we have to get around. From the scientific point of view, there's a lot that we could offer in terms of advancing that conversation. The other problem that we have is that, as opposed to what happened with tobacco, we do need energy. And by and large, energy today comes from fossil fuels. So we cannot, as we did with tobacco, say, well, we have to introduce bans, we have to introduce it. We could do it, but it's a lot more difficult to do it in a way that protects people's access to energy. And the problem of the just transition, of technology transfer, of support to those that most need access to clean energy is something that happens at the political spaces. So from the point of view of us as scientists, we can build the evidence case, not only of air pollution, that is one of the contributions, but also the harms of the fossil fuel industry on site of extraction, open flaring, contamination of local resources. That generally happens, again, in communities and in settings that are very underserved and that are generally very neglected. And there's a lot that we need to do in terms of taking accountability and our contributions to exposing those harms. Those could be some of the strongest arguments to start shutting down some of those plants, some of those extraction sites. The final problem that we have is that it's a very, very powerful industry, and they use very clever techniques to get around the problem of social mobilization and credibility on the science. So building that social support is a lot easier when you have a steel plant with chromium contamination and fetal defects than it is when you have such a powerful industry like the fossil fuel industry that has such a good marketing machinery behind them. So in our position as health professionals, as advocates for health and well-being, and in our position of trying in terms of being those qualified to protect people's health and well-being, we also need to be very courageous and very outspoken and very rigorous about what we're saying, not being advocates or kind of activists. That's a different thing that we can do in our personal capacity. But in terms of our professional capacities, we have the science behind us, we have the knowledge behind us. So speaking truth to power is something that we can do almost as good as no one else when it comes to health. And we need to be courageous and ensure that we are sharing the message, that we are opening those conversations from a point of respect and rigor to get people on board with the urgency of the transition.
Very, very well said. Thank you. Thank you so much, Dr. Marina. Really, really helpful perspective. So just moving on now, I do want to direct a question towards Annabella, as you did a very powerful job of capturing kind of the ways in which we can transform systems of inequality in the process of this transition. I do want to ask, kind of from your perspective, what practical steps can international movements and policymakers take to center community voices, knowledge, and needs in transition planning? And how do we make sure that the promises of social protection and decent work materialize where they're needed most, particularly in contexts where state capacity or political will may be limited?
Yeah, thank you, Hannah. And I think there was also a similar question, in the chat. I think the health community, as Marina was saying, is such a powerful voice. One that people in the communities recognize, acknowledge, are seeking advice from on a variety of things. In general, these are the professionals that people rely on, even in their daily lives, for advice, for support. I think one of the things that this community, along with the climate community, must do is to show that our commitment to tackling the sources of climate change, for phasing out fossil fuels, is not coming from a privileged perspective. It's coming from a need, and that we have a vision about how we do this in a way in which normal people are at the center, that their needs are reflected, because actually the fossil fuel industry is not really responding to their needs. But the fact is that the transition is not really being organized. So I think there is something about the way in which we engage that needs to go, that needs to build on science, as Marina was saying. But I think it's also about touching a little bit more the hearts as well, and trying to get us to a place where our demands are also reflecting on quite substantial concerns that people have about their livelihoods, about their future, about their jobs, about what they're going to eat, if some of these industries just walk away. So I think there is something on the messaging, on the narrative. I think that with COP this year focusing quite substantially on just transition, we also have an opportunity for better connecting some of the key things we need to strengthen health systems, like universal social protection, like we have all the conversation about occupational health and safety that we didn't touch much, but the fact that, well, of course, with climate, we also have increased risks for a lot of communities, a lot of workers, and this also needs to be captured in the way in which we are approaching the transition. So there are so many connections there. There are fights for health. Health harm and reversing harm also on the ground by this industry. So we have an opportunity in COP30, I think, for our communities to talk more together. I also wanted to invite this community to what we are calling a Just Transition Rising that is going to take place in May. It's a digital convening, and we are hoping to have hundreds of people from around the world, from communities, to talk about what this just transition that we want to build these days needs to be. I think the voices of this community would be amazing to have. So we will certainly extend the invitations to all of you to come and join. Like feminist groups and justice experts and people in the front line. So yeah, I think if I want to leave you also with this sense, is the sense of possibility. I think we are in a very dark place right now. And I think we need to be doing things differently if we want to have a different outcome. And I think we have, with this mobilization of the health community against the fossil fuel industry, based on data, based on research, but also an extra push on making the transition away from fossil fuels socially strong. I think we have an opportunity to leave them behind.
Great. Thank you so much, Annabella. Very, very powerful words. In the name of time, I know that we are at the hour now. We did start a bit late, so I do want to kind of just give Banang a chance to answer a question that has been directed towards him in the chat. So I'm going to just finalize with this question for Banang, and then we'll kind of wrap up our discussion. So we have a question for you, Banang, which is just that you mentioned that this approach could be transferred to other countries. So I guess the question is, what are some factors that can help to facilitate this action of replicating what's been done? And then more broadly, is it possible to transfer this approach to other sectors besides healthcare as well?
Okay, in the interest of time, thank you so much. I saw the question. Yeah, it's very important to highlight that well, the most important factor that which led to us to transit was actually the level of healthcare that was provided to our patients. It was very much affected by not having the proper equipment, be functioning in terms of diagnostic machines, the refrigeration of vaccines, which keep up the efficacy of medicine. Actually, that affect the delivery of our healthcare. And I think the same model can be duplicated in other places in that we are ready to share information, to share the initiative. We can always keep, in contact with whoever is interested so that we can share what we have done before and what we are actually experiencing after. So, and every other, initiative that we have done, we are willing to share that information. Yes, even to other sectors, I think it's highly possible. In the context of Lesotho, where I have talked about a mountainous terrain, even the schools are still, in the educational sector, schools are still, located in that tough terrain. I think we can do the same in other sectors and, electrify schools and such things like that. I think it's very possible. Thank you so much.
Thank you so much to you as well, Bonang. So thank you to all of you really for these really critical perspectives that all kind of touch on different dimensions of this essential topic. So as we kind of come to the end of the discussion in the sake of time, I think it's very clear from the discussion that transitioning to clean and healthy energy in the global south is not just an environmental imperative, but a public health necessity and a step towards greater energy justice more broadly. So we've seen this perspective shared through our different speakers' interventions, including looking at how the impacts of fossil fuel dependence go beyond emissions in terms of touching lives, straining healthcare systems, deepening inequalities, and then also seeing how the potential for positive change can be created when communities are placed at the center of this just transition. And so given those perspectives, we hope that those who have joined us today can kind of move forward with some of these tools, particularly when it comes to advocating and leveraging the voices of the health community in this space to advocate for a transition that is truly just and equitable and has these co-benefits of reducing inequalities and bringing the health gains that it can achieve. We thank everyone that has joined us today for this meaningful discussion, and we really hope to continue moving forward in this conversation in the future. Thank you all.